Thank you and welcome. I'd just like to say that before I start my presentation, that these are my findings from over the last year while I've been looking at staff care, support and wellbeing through the trauma lens in East Lothian Council. So I sit within the organisational development team, and these findings have been shared with them. So we are in agreement that this is sort of our general view of what I have found. I'm aware that other organisations may have had different findings from doing something like what I've done, but I hope that everybody will be able to take something away from what I'm about to share. And I hope this conversation starts or supports further conversations about staff wellbeing. So our approach to wellbeing, so information gathering. So when I came into post, there was little guidance on how I was going to implement trauma-informed practice. So it was, let's see how we can do this most effectively. And it was agreed that I should target the services that worked with people directly, so face-to-face services. So it was when I was doing this scoping exercise that I started to discover that there was definitely issues with staff wellbeing that needed to be addressed before I could move forward with implementing the trauma agenda. So what I did was alongside mapping out the services of what they did, but we also looked at what wellbeing and support was available to different services, because I found that different services did different things basically, because it was a service needs led, and which is great that was already happening. But also it was looking at what was available to all regarding support and wellbeing. And then as I was going around teams and sort of started thinking about the training and how we were going to implement it, we asked staff directly about their wellbeing and what they thought. And I was going to say, reviewed the feedback from the employee yearly survey, and it was interesting to review the absence data from human resources, because that sort of threw up some nice surprises and unexpected surprises as well. And I also became part of the Healthy Working Lives group, which is our sort of group of staff from across different services that come together once a month to look at staff wellbeing. So this is really what I found. So within I suppose that all the different services that I worked with, and I won't go into list them, but it's all what I will say, your usual range of council services that we found, one-to-one supervision, support, employee conversations were taking place, but not in all services. It's understood that, this is probably similar to other councils and other organisations. I think the biggest find for me was that there's little time and space put aside to reflect on practice and staff wellbeing, which was a bit of an eye-opener coming from social work, which we all probably complain about it from those that have come from social work and that type of care background. There is, we do a lot of chatting about what we experience, and then when you go into services and realise actually this is not really that common a practice. So that was quite eye-opening. There wasn't much focus on building relationships. People seemed to only speak to each other if there was a problem. Some people were reporting that they could go, they worked very on their own, very isolated, but could go quite a bit of time without actually speaking to somebody, and they would only speak to somebody if there was an issue, or they would be spoken to if there was a problem. Which isn't great for relationship building, which we all know is key to having a good sort of workplace sort of environment, and research also tells us that. So we also found that there's information about community support, but it's not that's available to staff, but it's not promoted regularly or updated on our intranet or council website. So again, a lot of people don't know about it or didn't access that. And that there is no resource for staff wellbeing and support, particularly this side of COVID. From what I've gathered from our human resources is that before COVID there was a little bit more, But after COVID, things have definitely shifted to being less resources and things just not being reinstated. And I don't know if that's connected to perhaps more people working at home and having hybrid working patterns changing. So that's something that we always need to sort of bear in mind. And I think it's interesting that these findings, because they sort of are reflected in the Working Life Scotland report of 2024, and it's just suggests that the people in the public sector particularly are beginning to disengage a little bit with their work. And that they don't feel as though their voices are heard in some of the decisions that are made as much as they were previously. And what it says about this data is that this is reasonably new data, so they're not drawing any conclusions from it yet, but it is definitely a trend that we need to keep an eye on, which I thought was very interesting from a wellbeing perspective. So I split the findings actually into two because I wanted to highlight the absences, particularly as that's something that I think in this sort of circumstance, the culture that we're working in at the moment, and also our circumstances, is we are all looking at ways to perhaps save money and be more cost effective. Wellbeing is perhaps one of those areas that we could do better in, and this could actually impact on that. So like other councils, our psychological absence is our number one cause. And it is higher in certain parts of our services, like health and social care and education, which wouldn't surprise people. But what was really interesting, and this is what I was referring to earlier on, but it also highlighted that psychological absence is a number one cause of absence in facilities services such as facilities management. And I looked at the workforce and had some discussion with these teams as well. And there was multiple factors behind this. And it came down to that people were working multiple contracts to make a living. The impact of the cost of living had a massive impact on this service. A member of this workforce had probably experienced adversity more than perhaps other parts of the workforce, which fits with what some of the research that we know, particularly around sort of trauma, that there are sections of our society that will be impacted by trauma more, and perhaps this section of the workforce draws more from that. I don't want to make any sort of assumptions about it, so we need to be careful on that one. But when you talk to people, there's definitely I think more adversity experienced in general there in people's private lives. And generally, psychological absence sits around 22% per year for all councils, and that was from our human resources. We are, what I will say, is slightly higher, but then that could have been just that particular year. It's difficult to say. But again, research suggests that across all the workforce is 25% is pretty much your average for psychological absence. And that's been stable over a number of years, and that came from the Working Life Scotland report again. So just thinking about the what research is telling us is that there is a decline in job satisfaction within the public sector. So I mean, what it's telling us as well is that there's a higher sort of absence rate in the public sector, and this has been higher than there is in the private sector. So I think the figures are, so on average, an employee will take 7.8 days off over a year. But if you break that down, we can see that in the public sector, it's sitting about 10 days per person, and in the private sector it's sitting about 6 days per person. And I suppose my question is, I wonder what that's about. There's been, when we've discussed that and looked at that as a team, as an organizational development team, we're saying that there could be multiple factors. Is that, you know, we are being asked to do more and more as employees, and we're doing multiple jobs. We're having a lot of pressure put on us. We all continue to work through COVID, and we changed our jobs. We're constantly having to adapt. We need to think about those pressures as well, and also the impact of austerity that's had on public sector over the number of years. So lots of sort of reasons there that, you know, perhaps that could be happening. So I was going to say, I don't think it'd be any surprise about mental ill health and musculoskeletal injuries being the top two cause of absences. And what I hadn't even thought about was, when I was doing some research on this, was presenteeism and leaveism, which is basically presenteeism when people are working when they're unwell. I'm sure we've probably all done that. And leaveism, people while working on leave and taking time off and using that to catch up with their work as well. So yeah, there's lots of things there that yeah, I think we need to bear in mind, particularly as we're moving forward into more challenging times. I was going to say, the other thing that struck me within this when I was looking at the research was the sort of putting a gender lens on it, that actually it's women that are more affected by absences than men, particularly for these two issues, the mental health and musculoskeletal injuries. So moving forward, what has helped us? So services have actually come and asked for training and information sharing sessions, which are focused on staff well-being and trauma. These have been, as well, I have been able to do this, co-produced with staff, asking them what would they like the training to focus on. So for example, I worked with facilities management team leaders, and a lot of that was focusing on them as team leaders supporting staff well-being and understanding trauma. So their well-being actually came first, if you like, and we were looked at what's available in the communities, what could they signpost to before they started using the EAP program or referring to occupational health. I suppose the other thing that has helped us move forward is that we have been able to allow staff, you know, the time and space to share their views, particularly our customer services staff, who have been able to share their views in a psychologically safe space, which they seem to get a lot of benefit from. I think, you know, that's helped them prepare for changes that is coming to their services. And then, you know, being able to move forward from that, we've been able to deal with that, but then also think about, you know, what it's like for them dealing with customers with their uncertainty, but also the customer's uncertainty as well. You know, the other thing that I've been focusing on is working with the wider organisational development team, looking at how we can review leadership behaviours. And what's happened there is that we have something called the East Lothian Way, which identifies sort of behaviours that we're all supposed to adhere to, shall we say. We've put that into more trauma-informed language, being more sort of explicit in what we mean by our behaviours. We've been able to develop leadership behaviours and workshops around that. For example, 360 questions, getting feedback from employees who on their team managers, and this is all being sort of tested out and piloted at the moment to see how we can move this forward. And we've also reviewed the personal development process, which we call PRD here. And it's realizing that actually it's not about, you know, once a year sitting down with somebody to review, you know, what's gone well, what hasn't gone so well, where would they like to go. It's about, you know, meeting them where they are at the point in time. And actually these conversations can take more, placed more frequently rather than just a one-off during the year. So again, it allows that sort of relationship to be built between staff and management. So that's the purpose of that. And they've also simplified the forms that need to be filled in and completed, which people are saying is a lot easier to do and a lot more friendly to do. So I've reviewed as well the council-wide employee survey from the last couple of years, and there's one that's just been done. And the feedback is pretty consistent about that and fits with what people were sharing in the workshops that I've been doing. So there is some consistency there, and the plan is there then to now start feeding the written feedback to team leaders and supporting them to actually enact on that feedback, because that hasn't been done before. And that was sort of, I think, the bits that people were complaining about. They were saying this is what we need, but actually nothing's ever done about it. So it's allowed us to address some of that. And again, as I said, being part of the Working Lives group has been able to make connections with other people across the council who are also interested in, promoting well-being and better working lives for people. So what's not helped? Well, I was going to say, I think we've probably all heard this lack of funding, short and long term, for staff wellbeing and support. It's very similar to the trauma agenda. It's very difficult to plan when we are unable to take anything, sort of have any policies to take anything forward, and we don't know what's happening. I have found gaps that, there's very little guidance policies that cover some staff areas of staff wellbeing. There has been some, shall we say, discrepancy in how people see and whose responsibility is for maintaining your individual well-being. So the manager's role in how they influence and support well-being by their behaviours is less understood. So I need to do a lot more research on that and finding out about that. Because this is often seen, as I said, as a role of either human resources, healthy working lives, or the individual. But I think, from my point of view, this should be also about, the organisation and team as well, which is what we try and promote through some of the trauma-informed and responsive training. So staff wellbeing and support is not always a priority for services, as there's competing demands with service delivery that we're a lot of services are short-staffed. Sickness rates can be high, so staff jobs need to be covered, so which can have an impact on how people look after themselves, and also where staff wellbeing is prioritised. And I think also, again, there's no specific role within East Lothian to take a lead on staff wellbeing and to champion that. And that's something, again, it's tagged onto lots of people's different jobs, which is, again, doesn't always get the priority perhaps it should have. So yeah, for messages for people starting this journey is, as I said, staff wellbeing and support is not always seen as a priority. Managers' behaviour should build space for teams to talk and feel heard. And I think that is absolutely crucial. Wellbeing isn't about initiatives such as gym memberships and classes, because I think, again, backed up by research, what it is about, people having that time and space to be heard, listened to, and their ideas perhaps acted on if appropriate. There's a lot we can do to support individual wellbeing before we refer to employee assistance programs for mental health supports. That's looking at our supports in the community that, again, aren't utilised perhaps as well as we could do. It's trying to keep that up to date, but again, very difficult when there is nobody keeping a full-time eye on that. So there is a lack of funding resources to support staff, and we know that this has been in decline for several years. The messaging from Scottish Government research tells us that we should focus on wellbeing and supporting staff, as we are the most important resource that we have, but that is really in conflict with what happens in practice. And I think that's probably, the biggest frustration that I have come across, is that we know what should happen, but actually in practice and reality is we're too busy delivering the services that we need to deliver to look after ourselves. So what are we doing moving forward? And I've tried to actually link this to the roadmap that we have. So you'll see the wee symbols on the side on the side there that sort of I think where they fit in. So what we're trying to do is build resilience in the teams to manage well-being, change, and the lack of resources. So it's about supporting teams to think about how can they support themselves with the changes and the transformations that they're having to go through as resources become more scarce. And that's not an easy task. So it's been incorporating more about well-being into trauma training. So I've made that a priority. So I always start with that because I like to check in with where people are before I deliver the training. And often this allows people time and space to talk about how they're feeling, what's happened for them, and also it allows other people to connect and sort of make suggestions as well. And the other thing that I do there within that is I bring in the ABCs of trying to avoid vicarious trauma, and say you've got 6 questions that you should all know about each other in your team. So by promoting that is one of the things that I've been doing. And that's part of, as I say, part of the trauma-informed and responsive training I've been delivering. Being person-centered is now one of our leadership behaviours, which has been defined with the input of employees as to what this means, which I explained earlier on. Consideration now being given to more focus on staff wellbeing within the resources that we have. So it's really sort of now thinking about what was available in the community. How can we keep our, I suppose, information up to date so people can access it and is readily available to people? As we have something called the listening ears, which is actually employees who have all been mental health trained through mental health first aid trained. So that is a service that people can use before they go on to the your employee assistance program, or perhaps into occupational health. So that's something that I have actually become while I've been in this role. So we're now reviewing the employee survey and sharing that with managers to create feedback loops, and raising awareness of the impact of wellbeing on council measures and outcomes. So trying to link these with our performance and how we are working with the people in the community.